Hi, everyone. This is Dr. Cliff Faver here with our weekly Pet Skin Academy blog here. And I just wanted to talk about old dogs this time. A lot of older dogs tend to have skin and hair problems, and a lot of people don't understand the why in that. But we have to realize as we age, our organs age, a lot of our hormonal producing glands will change with time, whether they oversecrete or undersecrete. But we start getting changes in our metabolism. And once those metabolic changes occur, then a lot of times we produce toxins. And we have to remember the skin is an excretory organ. It actually excretes out those toxins. Now, typically we think of the liver and kidney as our main source of uh, detoxifying the body, but the skin also does that. And so as it detoxifies when we get older, then a lot of these byproducts, those toxins end up on the surface of the skin, thereby changing the whole environment of the skin, a lot of times the pH of the skin, and we start getting hair loss, we start getting infections, we get a lot of these changes. So it's very, very important if we have a dog that's older, especially over than about 7.5, I always recommend blood work. Now, if you're going through the Pet Skin Academy, when we have you do your case studies, we have you do blood work every time. And the reason we do that is we want you to get used to it, number one, but there are those oddities out there that have hormonal problems or have liver kidney problems even at young age. I found this with Dobermans when I was practicing medicine. I had a lot of them that we couldn't get pregnant. And we go to checking them, and a lot of them were low thyroid. Put them on a thyroid supplementation, and they got pregnant the very next time on that. So there are those dogs out there that have issues on the overall. So, like I say, Pet Skin Academy will have you do it every time. But as a routine, if you have an older dog, we always need to check blood work. Otherwise, we may be wasting our time with their therapy or with what we're trying to do because the body's fighting against us. Hope that helps. We'll see you next week.